Well, welcome everybody to a very special series called the Covid-19 Wellness Series that is put together by Serve Canada in association with ARRA Arts in support of Trillium Health Partners, and the Trillium Health Partners Foundation. They have three hospitals that Trillium takes care of: the Mississauga Hospital, the Credit Valley Hospital, and the Queensway site. Regional hospital providing world-class healthcare for a healthier community right here in the GTA. My name is Jake Dheer. I am blessed to be sitting on the board of the Trillium Health Partners Foundation. And joining me is my dear friend and host, as well as the founder of ARRA Arts, an organization along with Serve Canada that are doing exceptional work. And they're the ones that are bringing this COVID-19 Wellness Series together. Today, we have a very, very special guest. I'm going to invite Anu. Anu, welcome. And please tell us a little bit about our guest. But before we do that, Anu, speak a little bit about the impetus behind COVID-19 Wellness Series.
Hello, everyone, and welcome to the COVID-19 Wellness Series. At the foremost, I would like to bring the greetings from our elected officials for endorsing and supporting the COVID Wellness Series.
Thank you to Serve Canada, Trillium Health Partners, and ARRA Arts on the launch of the incredible initiative to highlight mental health and wellness. I know this pandemic has been tough for a lot of people, especially on their mental health. And the reality is that no one is immune to it. Everyone can sometimes experience burnout, depression, anxiety, and isolation. I hope that through this series, you can learn how to care and maintain your mental health. Your mental health is just as important as your physical health. Even though you may feel alone or helpless, I want you to know we have your back. If you need someone to talk to, please reach out to some of the amazing mental health and addiction agencies in your community. Thank you and God bless you.
Mayor Bonnie Crombie here from the great city of Mississauga, sending my best wishes to all the organizers and participants attending the COVID-19 Wellness Series hosted by Serve Canada and ARRA Arts in collaboration with Trillium Health Partners. COVID-19 pandemic has brought so many uncertainties to our lives and has disrupted our way of living. It's okay to not feel okay during these uncertain times. It's important to stay active and stay connected mentally, physically, emotionally, and spiritually. The COVID-19 Wellness Series is an opportunity for people to distress and take care of their mental health and well-being. By showing up at today's session, you are making your mental health a priority, and you should be very proud of yourself. Brighter days are ahead. In the meantime, stay healthy and stay safe.
Hello, I'm Amita Ray, your Member of Provincial Parliament in Mississauga-Streetsville. On behalf of the Province of Ontario, I would like to recognise Serve Canada and ARRA Arts for hosting the COVID-19 Wellness Series of workshops in collaboration with the Trillium Health Partners. The COVID-19 pandemic has impacted so many of us with feelings of anxiety, depression and uncertainty, but it is important to know that help in various forms is available for all of us in our community. The 10 virtual workshops by Serve Canada and ARRA Arts talk about how to care for our mental health or wellness and other common health issues during the pandemic. We are thankful to Mississauga residents like Anu Srivastava who have taken the initiative to help our vulnerable populations through the COVID-19 Wellness Series. I would like to thank all of you for physically distancing and doing your part to combat COVID-19 and ask that you continue to please stay safe.
Hello, everyone, and welcome to the COVID Wellness Series organized by Serve Canada in association with ARRA Arts in support of the Trillium Health Partners. Serve Canada is a health and wellness organization and with the health and wellness platform, and ARRA Arts is a social wellness organization. And the overview of the initiative of the COVID Wellness Series is really to provide 10 virtual workshops which will help all of us with coping strategies that range from medical to alternative methods. As we all know, COVID-19 came about 6 to 8 months ago, and who knew that this was going to last this long? And the initiative with We Serve Canada and ARRA Arts was the brainchild sometime in the summer months when the thought was that this is not going to be going very soon, and we really needed help on the way. So these 10 virtual workshops are really going to help each and every one of us in trying to overcome the difficulties, the challenges that each and every one of us are facing during these difficult times. And I am so proud to introduce our two panelists who are with us today. And my first panelist I'm going to talk about is Dr. Amita Ray. She specializes in obstetrics and gynecology, and she has worked not only in India, but in Australia and New Zealand and United Kingdom. And the facets of Dr. Amita Ray is far and beyond just the medical and the clinical piece of it. She is also a medical teacher, a professor, and she teaches the medical undergraduates and postgraduates and helps them in conducting licensing and qualifying exams. And she is also a researcher. It is my pleasure and it is my privilege that Dr. Amita Ray is my childhood friend from St. Mary's Convent, Kanpur. And it is my pleasure to introduce her as a panelist. And next we have Dr. Sujoy Ray, who is a psychiatrist who's practicing in India and has also worked in the United Kingdom. He's also a medical teacher, a researcher, and he's extremely passionate about the use of technology in the medical science field. So I'm really delighted to welcome both Dr. Professor Amita Ray and Dr. Sujoy Ray. Welcome. So I'm going to now jump to the first question, and the question is to Dr. Amita Ray. Since your field is all obstetrics and gynecology, I'm obviously going to head to that sort of a question, is that when um, a pregnant lady, um, is she more susceptible to COVID-19? And is she likely to catch the infection more than a normal, I guess, person?
At the outset, I would like to thank We Serve Canada and my dear friend Anu. I am meeting her after about 35 years. So thank you, Anu. In answer to the question, I would like to first say one thing. This COVID-19 situation is a very evolving situation. We do not have the whole evidence as of now. So, whatever I'm going to say today is going to be whatever evidence that we have been able to collect till date. And in this context, I would like to say to you that this pregnant women are not susceptible to COVID more than the general population. So they are as much susceptible to COVID 19 as is the general population.
And if they violate the rules or the dictates that have been given to them, they are as likely to catch the infection as is the general population.
Okay, thank you so much, Amita. That it's good to know that we are all in the same boat, and everybody, the
Yes,
virus affects each and every one of us in the same way, really.
absolutely.
Coming to my second question is, what is the effect of COVID-19 positive pregnancy on a newborn? So the way I understand is it's somebody who actually has a pregnant woman who has COVID-19. and she has a newborn baby. What is the outcome of that?
So, again, speaking for the fact that we are still collecting evidences to prove certain things, I would here also like to give you a good news that up till now, the COVID-19 infection has not caused any congenital abnormalities in the newborn. That means that some structural defect, some organ defect, or something that we see in many conditions where some infection may affect the pregnant woman, or she may have taken some medications. So, fortunately, for that matter, COVID 19 does not seem to have had any of such an effect on the newborn. That is one positive thing. Coming to the next part of it, we have been able to isolate the COVID 19 virus from places like the amniotic fluid and the placenta. So it leads us to believe that the COVID 19 virus may be being passed on from the mother to the baby. But again, at the same time, it has not caused any added adverse effect on the baby as such, neither in terms of the structural defects nor in terms of any other congenital abnormalities. So, this is the good news. Now, after the baby is born, the if the mother is COVID-19, we have also got now evidence that she can continue to give her breast milk to the baby, because you see, the breast milk is supposed to be the best for the baby, and many people might think that, okay, I am COVID positive, so I should not feed my baby. Well, that is not so. Till now, the guidelines or the evidences say that the lady can safely feed her baby, but she has to take the precaution of masking herself when she handles her baby and taking all the due precautions like washing hands, etc. So, having said all these three things, you can well imagine that, as such, to the newborn, the COVID 19 has not had such an adverse effect as we were afraid of. But again, I would like to tell you that evidence is still evolving, and maybe some more additional information comes up as the time progresses.
No, Dr. Amita, that is just, I mean, we are so happy to know that at least that there are no adverse effects as of now, with all the evidence that you have had received so far. This is very good news for all the young mothers or the new mothers, that they can breastfeed their babies, and also that there is no adverse effect on the newborn. Thank you for that good
So,
news.
Anu, I have in India here now, since the lockdown started and since the COVID started, we at our hospital have delivered thousands of babies. Right from March onwards to today, we have delivered thousands of babies, both by cesarean sections and normal deliveries, and there have been many, many COVID positive mothers. So, till now, I, from my own personal experience, can corroborate the three facts that I told you, that breastfeeding is not contraindicated, COVID is not causing any congenital abnormalities in the baby. It is being isolated from some parts of the mother's amniotic fluid or placenta or even the baby. But thank God, it is not having any much severe effect that way. So we have treated thousands of COVID positive mothers.
So, I mean, for those of you who are just joining us, we are talking to Dr. Amita Ray and we are talking to Dr. Sujoy Ray, and they are joining us from India. And we are getting firsthand information from these specialists as to what is happening in India as of now. So, I'll move on to my third question. Um, Dr. Amita, is the manifestation or the presentation of COVID-19, is it different in pregnant women as compared to, let's say, the general somebody else who would have gotten this COVID-19, or would it be the same?
So Anu, again, I'm happy to give you this information that again, on basis of evidence, we are seeing that the COVID-19 infection, when it infects the pregnant mother, it has almost the same features as in the general population. So let us say, as you must have heard and known, that 70 to 80% of such cases who get the COVID-19 infection are asymptomatic. That is, they don't have any symptoms at all whatsoever. And that is true for pregnant women as well. So that's good news. And if at all there are symptoms, they are almost similar to what the general population gets. So let me say that the most common of these features is fever, and of course there is cough, and there may be loss of sense of smell, and these are the three common things that we see in the general population, and the same is the true for the pregnant mothers as well. Now, another thing, let me tell you at the same time, lest you lower your guards, you must know some other things also. And that is the fact that when we have studied the pregnant woman who got infected in the third trimester of pregnancy, that is, means the last 3 months of pregnancy, the complications or the outcomes were quite severe. So, what I mean to say to you that although all the three questions that we answered today, that the pregnant lady is not much susceptible as compared to the general population, the adverse effects on the newborns are not that much, and also the symptoms are not or almost the same as in the general population, we cannot let down our guards. So, again, to the pregnant mothers, whatever it may be, you have to take your precautions as prescribed by your country specific guidelines.
Health information, Dr. Amita. I mean, it is so important for all of us to be very, very careful during these times, because we all know that COVID-19 is a virus that can actually be, the more cautious you are, the better you are going to be. And that's the way it
Absolutely.
is.
One more little thing I'll just add for my pregnant mothers is that one fact that has come to light quite recently is that the influenza vaccine should be taken by every pregnant woman. Some cases that we have seen where where the lady had influenza plus COVID-19 infection, there the effects have been very severe, both to the mother and to the baby. So, all the countries mostly are now telling all the mothers that please take your influenza vaccine, and it is not contraindicated in pregnancy, rather it should be taken, because god forbid, if you get influenza, you will be more susceptible to COVID, and if you get COVID with influenza, then there may be a lot of trouble. So influenza vaccine should be given to pregnant mothers as well.
I'm so glad that you brought that point up, because a lot of people have that thing in their mind that it is only a flu shot. Should we really take it? Is it going to really help me with, because this is not a COVID-19 vaccine. But really,
Absolutely.
what Dr. Ray is saying, and what we also know, uh, is that if you take the influenza shot, it reduces the risk and the severity of all the other infections or other issues that you might actually have due to any other things that might come during your term of pregnancy. No, that's wonderful. That's so good to hear all that detailed information. Now, when a pregnant woman is going through the term, and if we are to think about the last 8 months, somebody who probably got, let's say, pregnant in April, May, or something like that, and not knowing what exactly the scenario is and what this virus is, and if they needed any help in terms of trying to find out how they can better manage their pregnancies, was there anything that was available from a telemedicine point of view for these pregnant ladies? Like, I'm talking more specifically in these last 8 months, I believe, if we can put it that way.
Now, since the COVID has started, telemedicine has become very important for us. See, the need to learn all these technologies and the need to use all these technologies have gained a lot of importance since COVID has come. It has made us realize that a lot of things can be done with this platform, and same is the case with your pregnancy checkups, let us say. So if the lady is pregnant in April, was pregnant in April, May, something like that, the guidelines as of now say that they could do some consultations on telemedicine with their respective caregiver. So I'm saying caregiver because different countries have got different protocols for caring for their pregnant mothers. Here in India, we do not have midwives. It is all the obstetrician who does the caring during the pregnancy time as well as delivery as well as anything for the pregnant mothers. Whereas in UK, there are the midwives who are very, very good at doing all these things, and actually they handle all these things. So whoever may be the caregiver specific in that country, the lady needs to remain in touch with the caregiver. Now, when can she have a telemedicine consultation, and when does she need to go physically to that place? So here there is some guidelines. So if it's just a query to be asked, if it is just a report to be shown to the caregiver, which this can easily be done by telemedicine, and it should be done. Why? Because going to the hospital, the pregnant lady is again getting exposed to COVID-19 infection with so many other people, because it's a social platform where everybody is coming. So better to limit these exposures. So what can be solved by telemedicine should be solved by telemedicine. However, a word of caution: if a physical examination is needed, let us say that she is due for a full checkup, BP, pulse, the fundal height, or whatever is there, if that checkup is needed, then of course you can very well understand that telemedicine will not work. Well, that time the lady needs definitely to go to her antenatal caregiver with all due precautions. And most hospitals and even most clinics in India as well as elsewhere have created separate places for seating arrangements for these ladies who are waiting for their appointments. And there all the universal guidelines or the precautions are being followed, like using of sanitizers, wearing their masks, etc. So till now, these have been the two platforms. That is, one, the physical examination or the physical contact, which was going on earlier, but telemedicine has come to play a very important role. And counseling sessions, particularly Dr. Sujoy will tell you that counseling sessions can jolly well be done by telemedicine. Of course, that is at the discretion of the counselor. If the counselor feels that a physical visit is needed, well, then it has to be done. But as I told you, telemedicine has helped us a lot. It has reduced unnecessary visits. And it just like I have to show my report to my doctor, so I went to show the report. Well, that can be done by telemedicine, and you're not exposed unnecessarily. And every country has created helplines. All countries have created helplines for the people to connect with their caregivers. Individual clinics, NGOs, hospitals, tertiary care centers have all given their websites, they have all given their contact numbers, where the lady can easily get in contact, tell her concerns, and she will be guided whether this particular thing needs a physical visit or it can be solved by telemedicine.
Oh, that's really very, very good to know, Dr. Amita, that that sort of thing is also happening in India. Of course, here in Canada, we have that route where most of the appointments are virtual or online, is what they call, but it is no
Yes.
different than what you're talking about, a telemedicine way of doing it. But most of the appointments over here also, they get screened as to when there is a necessity for them to actually come for a physical visit versus when it can be done virtual or online through the phone or even through videos. So
Absolutely.
thank you so much for that. I think I'm now going to turn my attention to Dr. Sujoy Ray, who is a psychiatrist and a medical researcher and a medical teacher. Welcome again to the show. And I would like to ask you that during these unprecedented times and during this crazy global crisis, each one of us has been experiencing stress in some way, shape, or form. I'm not talking about people who are mentally ill, but I'm talking about each and every one of us. We are going through these crazy times, and each one of us are under so much of stress due to uncertainty and things that we don't know what are going to happen and that are not in our control. So, my question is, how do you protect yourself from stress, especially during these difficult COVID-19 times?
First of all, thank you, Anuji, and all the others who are involved in this initiative. It is very nice that, in these times you are taking up these queries and helping the public out there. And I'm very excited to actually join across so far away to an initiative so far away. And it's very nice to see we've been doing this in India as well. So first of all, congratulations to you all for doing these programs. So, firstly, regarding stress, so first we must understand what stress is. Actually, this word stress has been sort of used in very loose terms, but stress in psychiatric terms, when we say, it's actually a normal reaction to any situation. Like, for example, if you have an examination, or if you had a bad event in your, God forbid, event in your family, it's a normal reaction in a body. It's like you get a fever when you have a mosquito bite and malaria. So stress is a mental reaction, but it has physical components as well. You feel annoyed, you feel cringy all the time. So stress is actually a normal reaction to any adversity. So those who get stressed when something happens, it's normal for that to occur. People should not feel that, if I am stressed, if I am annoyed, it's something abnormal within me. Problem with COVID is that it usually, most stresses come and they go, and COVID has not come, and it has come but it has not gone. And for the last 8 months it is there. So the prolonged stress is creating a problem. So to protect yourself, protect yourself from stress, or to prevent the prolonged stress from affecting you, there are some things which a person can do at different levels. uh, Firstly, I feel that especially regarding COVID in these times, the first important one, the most important thing is that you should be careful with the amount of inputs that you have regarding COVID and regarding the news around you. The more news you have, the more stressed you are, because most of the news is negative. It is about death, and rightly so. I mean, there isn't nothing very nice to talk about, but you should limit the amount of news and information you get about COVID. That's the first thing. Secondly, you should take it only from proper sources. Like India, you have the Indian Council of Medical Research. If you have your Medical Council of Canada over there, and WHO is of course there. So whatever, you should concentrate on facts, not sensationalization. Unfortunately, that is what most of the news channels and all they do. But the health organizations will not do that. So that is the second thing. You should limit your knowledge, limit your sources of information. Thirdly, on a personal level, try to make a proper routine in your life. Like for example, if you have a lockdown, many countries have seen this. They went into lockdown, came back again, went again into lockdown. So whether you are in a lockdown state, or a whatever they call partial lockdown state, or whether you are open, you try to make a routine for yourself that every day I will do this at this particular time. I'll wake up at this time. I will devote this much time to work, uh, whatever it is now, because your initial routine, which must have been there before COVID, will definitely have changed. So for the current situation, you make a proper routine for yourself, that what time to what time you're supposed to do what activities, and keep some activities just for leisure, just for enjoying yourself, being with your family. So if you are in a predictable routine, because COVID is unpredictable, you never thought in the last, I mean, since I have been born till now, at least I have not seen any situation where the entire countries have been locked down. So this is an unpredictable thing. So in the middle of an unpredictable thing, if you do a predictable routine, so again your body and your mind starts to get tuned back in, and the that stress which was there because of this new novel unpredictable thing, that stress would go away. And lastly, this is on a personal level you can do, and lastly, you should gather whatever support you have, whether it is from family, whether it is from neighbors, friends. Fortunately, we have technology in this age that earlier we did not have. So the technology is allowing you to communicate with me from Canada to India. So if I have relatives, this could actually be a good time. I mean, if I have relatives in faraway countries or faraway places where I have whom I have not seen, thanks, maybe I shouldn't say thanks to COVID, it's not a right thing to say, but still, maybe thanks to this situation, I get an opportunity to just sit back and connect with everyone through internet, through phone call or whatever. So whatever maximum support you get, that will help, because you will know that you are not alone. Of course, you will know that you are not alone, you have support. They will share their stories, whether positive negative doesn't matter. I mean, facts are facts, but whatever it is, you will get to know that this is not that just it's happening to you. So the more feeling of togetherness, companionship you have, that others are also in the same boat, we are in this together, you and me together, that kind of a thing. So that will help. So all these are the things which you can do at a personal level, at a social level, and at the level of your news and information. That will, I will not say it will totally prevent stress, because as I said, stress will always be there. It's a normal reaction of your body, that's how we are programmed. But it will make it livable, and hopefully that stress will not have any long lasting effects. And once, fingers crossed, once this situation is improved, when you come out of it, you will actually come out much stronger. So that is the expectation that you would have if you use these measures.
No, I think you have said that so rightly, Dr. Sujoy, that the universality of the situation, that each one of us are going through the same thing, then that in itself is like it's a huge consolation for each one of us. And then to protect yourself through not listening to the media as much, and just being more in tune with your family, and caring, doing a proper routine, and all those things. No, absolutely, I think that is just great. Actually, that gets me to the next question, where we're thinking, like, unfortunately, there might be some people who might actually get affected by stress. And for those people, uh, where would they actually go to seek help? That would be the first thing. And the second also would be, like, how would you even know, like, your family or your loved one actually needs help? Because this is all so new and unknown to all of us, and we don't really know, what the person is going through. So if you can shed some light on that, it would be great.
Yeah, so that's a very important thing, because we have to know the borderline between stress and what could be potentially a mental illness. Again, I will repeat what I was saying earlier, that stress in itself is not an unusual thing to happen, but sometimes in some people, depend, like what you were saying, is that some people are more vulnerable, or some people already have so many stresses in their lives, and they may be going through their own difficulties. So they might definitely develop things which are not in the purview of normal stress. Again, there's nothing to feel ashamed about it. This is not that they are weak, or they are not strong enough, that's why they are developing it. So there's nothing like that. So first of all, how to recognize this, whether it is normal stress or whether it is bordering into something in which you need help. There are some very basic things. Say, let's say, for example, look at what you do every day in your life. For example, sleep. Simple thing like sleep. If your sleep is very disturbed, you or or a loved one of yours has a different pattern of sleep, finding it difficult to go to sleep, or sleeping during the day, feeling excessively tired even though physical activity is not there, or appetite. Somebody loses their appetite. Somebody does not like to eat what they like to eat earlier. Simple things like that. Or on other scales, they lose interest in doing things which they used to do earlier. That is also very important. Like say somebody would be enjoying watching the television, and actually you would expect that with the COVID lockdown and everything, they would watch television more. But if you find that that person is no more interested, sorry, in watching the television, and says that leave it, I don't want to see it, nothing really makes me happy anymore. I was mentioning about talking to family. You see that okay, we are communicating with family now, but he says that no, even then I don't feel any connection to them, even though they're my family. I don't feel the joy in seeing the relative whom I have not seen for so many years. So if that kind of a thing happens, that the person loses joy in what they earlier were expected to feel happy about. So these things may be maybe an indication that this is not just normal stress, and the person needs to seek help. And another thing I will say here, it may be a bit scary to say this, but this is being very stigmatized, so I must talk about it. Thoughts of suicide. Many people have had. I have seen this, that COVID is there. I'm ruined. My job is gone. You know what? How much it has hit the financial aspect also. So I am not able to do anything. My job is gone. There's nothing left in life. I might as well die. So these feelings of wanting to die, or wanting to just go to sleep and never wake up again, or some people, unfortunately, but some people have developed that they literally think of plans to attempt suicide. So suicidal ideas, or ideas of not wanting to live, this is very important hallmark. If this person anybody is developing this, or if you suspect that, god forbid, should anybody you love is talking like this, that I would go far away from this world, I would go far away from here, there is no question about it, that there is nothing normal about this, nothing to trivialize. This is definitely requires help. So these are all some of the cutoff points. Of course, you will find some people who will turn to things like alcohol, etc. That is another cutoff point, where this is like, there is no question about it. These are all things which you cannot call under the purview of normal stress. So these are all some of the things which you can notice in others, notice in yourself, that it means that it has gone somewhere beyond the normal stress. And so this definitely needs help. Now, coming to your second question, where and how to seek help. So that depends. So it starts from the home. It starts from where the person is. So, for example, let us say that you see in your colleague or a friend that he is talking like this, that I don't want to live anymore, I don't want to do this. First of all, you have to come and sit. You have to sit with him and ask him what is wrong. First, very important to be non-judgmental. Many people suddenly become afraid. Some people even say that, have you gone crazy, what is wrong with you? And that if that reaction is of fear, that makes the person feel even more guilty, that why did I even say that I want to commit, I don't want to live. This person is so scared, maybe I am wrong, maybe this feeling of having suicidal ideas is my fault. So that should not happen. So you should be very non-judgmental and caring, and allow the person to speak very honestly about what he or she feels. Having done that, obviously, how to deal with it is it is best that you approach somebody who is an expert in the field. Now, you could approach your general practitioner. For example, in your UK and all that, people go to general practitioners. Here in India, you can walk straight to say a counselor or a psychiatrist, depends on the system country wise. So you must take the person, or rather encourage the person to approach a medical or a counselor or a medical person of a medical background. Now, from there on, depending on how serious the situation is the person really very upset, or is it a mild sort of a situation, that person, the initial point of contact, the counselor or the medical person, will refer this particular person to either a psychiatrist, or will refer it to a counselor, or will refer, or in very serious situations, what I was telling you earlier, people who become so suicidal that they even need to get admitted in the hospital, which we have also done here many times. And there is really no, I mean, it's very difficult to say that exactly what the course of the treatment will be, but the approach should start at the home itself, It should start with the non-judgmental, supportive approach from parents, friends, family, colleagues, and then the person should be directed to the required to any proper registered medical practitioner or counselor, and from there on it can be taken up. And depending on how what the situation is, mostly the good news is, the good thing is that people who, if this is detected at an early stage, if the people are receptive to what is going on around them and they take these things seriously and encourage the person to seek help, there are very high chances that they will be perfectly all right. And as I said, he will come out from this challenging time feeling better and more accomplished.
No, you are so right. It is indeed very, very difficult and challenging times. And unfortunately, there might be some people who might not be able to deal with these difficult issues. And, and in those times, it's best to seek help. Now, definitely, thank you so walking us through, the things that people have when they have loss in their life, and it can be for whatever number of reasons. But it's always good to know that there's help around the corner and that we are not alone in this, and there are people to get us out through this. I'm going to ask the same question from Dr. Amita. Uh, is where to seek help from? And that is obviously for Dr. Sujoy. We asked from the mental health and wellness perspective. But Dr. Amita, I wanted to ask uh, where can we get, or whom can we seek help from when there's a need for these pregnant ladies, or from an obstetrics and a gynecological point of view?
So again, this when you need help, the first thing that you have to see is that even obstetrics has so many mental issues. It is said that being pregnant is a state where there are so many hormones going on inside your body, and they do affect your psyche as well. So there are two aspects to this care of this pregnant lady, particularly in COVID times. First of all, is her physical well being, and secondly, is her mental well being. The added stress of pregnancy with the COVID, and always a fear that, okay, if I get COVID, what will happen to my child? What will happen to the baby that is unborn? What particular difficulties will I face? These are always the questions that have been put forth to me by my patients who have come who were COVID positive. They are not so worried about themselves. What they are worried about is what my baby is going to have. Is it going to affect my baby? So here again, how we seek help and what we do is this again divided into two parts. About the physical part, about the antenatal checkup parts and all, I already told you that we have helplines, we have hospitals, and every country has now made uh, taken this telecommunication thing and has worked upon it and has given websites and helplines, etc. Coming to us obstetrics and gynecological people, we have also had to learn something about mental health. Firstly, particularly in India, we are so very focused on our own specialty that we do not focus on the other specialities. But if you see a human being can also have a gynecological problem, a mental problem, etc. And COVID-19 has brought the mental illnesses very much to the forefront. So we have something called perinatal well-being clinics and perinatal counselors. So these counselors are people who actually cater to the mental needs of a pregnant lady, be it COVID or be it not COVID. Because as I told you, pregnancy itself is a stressful condition. So even when there was no COVID, there used to be certain ladies who would not accept the pregnancy, or they were stressed out because of the pregnancy due to various reasons. So these are the perinatal people, perinatal psychologist, and which is a branch of combined branch of obstetrics and psychiatry, which deals with counseling such people and taking care of such people who are having stress either related to pregnancy or due to COVID or a combination. And now what tertiary healthcare centers, I think in UK, when we were working in UK, UK has got a very separate department of this and they always advertise their helplines as to how the ladies can approach them. But here in India, it is still in its infancy. So, what we have done is tertiary healthcare centers, we have actually set up a cell which has got all the telecommunication equipped with it, and we have a helpline as well. So if a pregnant lady asks for help, we ask them, okay, what is the problem? Is it a physical problem? Is it a mental problem? And when she specifies that this, we also judge what sort of help this lady requires. Can it be solved by telemedicine? Does it require a physical contact? Is she so much stressed out, as Dr. Sujoy said, that there are certain signs which are showing that she might go full-fledged into a mental ill person? We need to bring her in physically. So these are the ways that we are trying to cope up. Every country is having to learn something new. And as I told you, we never concentrated on perinatal psychology. Now we have to concentrate on perinatal psychology because COVID is here for quite long time. And now, even if COVID goes, stress doesn't go. Stress never goes. So it can come in any form. It can come in the form of a disease. It can come in the form of any loss. It can come in the form of any other such thing. So we have had to collaborate. So there has been a team effort. In India, we always run short of doctors, but in spite of that, you will see that the healthcare people have been working. We have trained ASHA workers. These are grassroots workers who don't have any medical degree, but they have been trained, coached by us in medical colleges. That is what the medical education part of it is. We are trying to tell, because these are the community health workers who are very well loved in their own community, trusted in their own community. So what they say actually sometimes is more important than what the doctor says, because the doctor is very far removed from them. Whereas these community health workers, they always meet them, they go to their families, sit there, chit chat with them. So we train these people and let them. They also, we make them aware that these are the signs in an antenatal lady when you know that the pregnancy is going wrong. And then we train them in the mental part of it also, that okay, these are the things that when the lady says, you should start suspecting that something is going wrong with the psyche. So these people then tell us that okay, this was our field visit, and when we went to the field we found such. So we send out some things to them, tell them that please come and show. Sometimes we get compliance, sometimes we don't. But these are the efforts, and every country, I guess, and more so, Anu, where you are there in Canada, there may be a more robust system of perinatal psychology and perinatal caring and all these things. So these are the ways that we are trying to see. COVID has been a great teacher, actually. I tell you, it has taught us so many things. So that's what we are trying to focus. When, as Sujoy says, when he starts his lecture with COVID, he first says, what has COVID given to us which is good? And of course, COVID has given lots of bad things. We want the COVID to go away. Please go away. But what will be our victory is what is the good things that COVID told us. COVID told us about hygiene. See, hand washing is a part of hygiene. So COVID has actually taught us. COVID has taught us not to overcrowd, to be considerate to each other, to sanitize our hands, not to be stressed out, how to stress with cope. COVID has taught us a lot of things. COVID has taught us actually telemedicine. So these are the things that we try to focus and try to bring it, and efforts are being made in all countries, whatever may be the status of the countries. Developing world is still far, I mean, has still a lot to do. Developed world has done a lot but still has a lot to do. So these are the situations, Anu, that we are trying to cope up with these two things.
No, Dr. Amita Ray, you actually put it so nicely that indeed, that even though we are going through a crazy global crisis, we still have learned so much from this COVID-19 pandemic. And all these things that you're talking about, really, in our day-to-day life, it is very, very valuable. And I really want to thank you for actually being part of this conversation. I really want to thank Dr. Sujoy for being part of this conversation. And it has been indeed my privilege and my pleasure to have my childhood friend over here and in discussions talking about COVID-19 pandemic in obstetrics, gynecology, and psychiatry. So thank you so much for that. What an insightful conversation it has been. Indeed, each one of us has to be really very cognizant of the fact that we are going through unprecedented times. And during these times, stress can really overtake our emotions. And we really have to think rationally and take a step back, fall into our routines, go back to whatever makes us happy, and get out of this situation. So, like Dr. Sujoy said, the universality of this whole pandemic, we are all in it together, and we are all going to come out of it together.
For those of you who are watching, I would encourage you to please provide as much support as you can. And, you know, during these unprecedented times, I mean, on a regular day, we need to make sure we're physically and mentally strong. I think during these unprecedented times, we need to be even more so. And some great advice, if you can, if you would like to donate to Trillium Health Partners Foundation, through the mental health unit, you can just, at the bottom of your screen, you'll see the link. Please do go there and donate generously. I'm going to ask Anu to come up and say goodbye and say special to some of our very special people, including the folks at Y Media. Anu?
Thank you, everyone, for the wonderful session that we've had. And I would like to thank Jake Dheer, who is very active in the community, for being a moderator and always being part of our series. And I would also like to thank our media house, Y Media, for all the wonderful work that they have been doing. Yudhvir Jaswal, Preet Jaswal, Gurpreet ji, and Angad ji. Thank you so much, Y Media team, for being part of the series.